Today we're going to talk about alcohol abuse. Alcohol abuse, when drinking is no longer fun, or when fun drinking means trouble. It is estimated that there are 135.5 million current drinkers in the United States. For most, drinking alcohol is controlled and safe. However, 59.7 million persons reported being binge drinkers, and 17 million people reported heavy drinking. Most people have a hard time distinguishing often when normal drinking becomes a problem. In general, drinking is considered an issue when it starts to adversely affect your personal or professional life, or when the person loses control over his or her drinking. There are certain factors that can increase a person's risk for alcohol problems. Certain genes make people more likely to have drinking problems. In fact, people who have a sibling, parent, or child who abuses alcohol have 3 to 4 times the risk of developing a drinking problem. Drinking problems are more common among men than women, but can certainly affect both. Alcohol abuse is common in people older than 65, which requires that we are vigilant about these patients. Having another mental health problem such as severe anxiety, depression, or a personality disorder increases the risk of abusing alcohol. It is known that 37% of those with a drinking problem also have a mental health condition. And in some occasions, alcohol is a way to try to treat those symptoms, which is not right, but is a natural tendency that the individual may have. That's important because treating these problems, these associated mental problems, is often an integral part of overcoming alcohol addiction. Experts use many terms to describe different types of drinking problems. We can describe the terms of alcohol intoxication, alcohol use disorder, problem drinking, and binge drinking. But we're going to focus on alcohol use disorder. This is the medical term for alcohol addiction, or what most people think of as alcoholism. People who have this type of disorder usually do this. They end up drinking more than they plan to, or they drink longer than they plan to. They wish they could cut down on alcohol, but they can't. They spend a lot of time trying to get alcohol, getting drunk, or recovering from being drunk. They spend a lot of time trying to organize all these things. They crave or have a strong desire or urge to drink. Often, they don't do things that are expected of them, such as going to work or school, remembering family events, and even cleaning their home. Some of these people with this disorder keep drinking even if it causes or worsens problems in their relationships or interactions with other people, and they are aware of that. Many of them keep drinking even in situations where it is dangerous to do so, like driving. Keep drinking even when they know they have a physical or mental problem that was probably caused or made worse by their alcohol use. It's the particular case of a patient who knows he has gastritis or a stomach ulcer or even cirrhosis, and yet despite all that, they continue to drink. They need to drink more and more to get the same effects they used to get with less use. Or they get less effect from using the amount that used to get them drunk. This is what we know as developing tolerance. Some of these patients will have what we know as withdrawal symptoms, which means that if they stop drinking alcohol after drinking for a long time, they start developing symptoms. Those symptoms can include sweating or a racing heart, feeling shaky, not being able to sleep, having nausea or vomiting, seeing, feeling, or even hearing things that aren't really there, which is hallucinations. They feel restless, they have anxiety, and even seizures. If you're trying to determine if you have an alcohol problem, please remember and ask yourself these. Have you lost control of your drinking? Have you developed tolerance or other signs of addiction? Has alcohol contributed to problems such as the loss of a job, legal troubles, or problems in relationships? Still, distinguishing normal from problematic drinking requires that you share information about your drinking habit and its effects on you. You have to do it. Share that information. Just remember that you're not alone and you need to get that help.